It's being called the most deadly substance abuse epidemic of modern times, opioid addiction. And on this edition of 11 TV Hill, we'll examine the rise in overdose deaths, the response by health officials and law enforcement, and the effort by local, state, and federal lawmakers to find long-term solutions. Hello, everyone, and welcome to 11 TV Hill. I'm Jason Newton, and the numbers really are staggering. Drug overdoses now outpacing car deaths and guns as the leading cause of injury deaths in the U.S. Those numbers from the DEA in Maryland isn't immune. You can see the numbers right for yourself. Right now, 1,259 people die after overdosing. That's in 2015. And we're on that same pace to possibly even top it with 383 deaths in just the first 3 months of 2016. Those numbers, they've gotten the attention of Annapolis. Governor Larry Hogan saying that fighting substance use disorder and the opioid epidemic is a priority. That includes training health professionals to identify addiction, making naloxone available to certified providers, and encouraging Marylanders to go ahead and seek treatment. All this as some are fighting an uphill battle against a cheap, powerful, and plentiful drug. Lead investigative reporter Jay Miller shows us the grim challenge of trying to get ahead of a growing heroin problem. Is it in your backyard? Probably.
These pictures from security cameras were taken last summer near a methadone clinic in Baltimore. They show an apparent open-air market for prescription painkillers. In the middle of the day, around a busy bus stop, cash and pills exchange hands. The pictures put the country's opioid addiction crisis in full view. And today's pill abuser is likely tomorrow's heroin user. Just ask this woman. We'll call her Tiffany.
Started using prescription pills, which led to heroin, which, put me where I'm at now.
On the street, panhandling to survive.
The pills became harder to get a hold of. They became more expensive. Doctors started cracking down on the amount of prescriptions that they were putting out. And the heroin was a lot easier and cheaper.
How hard is it to get here?
Extremely easy. You can get it anywhere.
In Harford County, the rising number of heroin overdoses is now put on signboards by the county sheriff's office. There's no hiding the problem here.
It's the perfect trifecta. Heroin has never been more plentiful, it has never been more cheap, and it's never been more pure.
Sheriff Jeff Gaylor tracks heroin overdoses on a map. Through the third week of April this year, there were 72 versus 47 same period of time last year.
The Bel Air zip code is where we see our most overdoses, but it's in every community here in Harford County, and anyone who does not think so is being naive.
Sheriffs now treat overdose scenes like these as a crime scene, not to target the addict, but to try to track the dealers. They call them commuter dealers, getting their supply in Baltimore, then selling in public places throughout the county.
It's restaurants, Walmarts. We've had several in Walmart bathrooms and in some of our local convenience stores, gas stores, and the restrooms. Again, the addicts are meeting the dealers there inside, and then they immediately go into the bathroom to shoot up and overdose.
Sheriffs provide referral cards to addicts here. The goal is to push them to treatment, not to jail. Since 2005 statewide, the number of methadone clinics has nearly doubled, from 42 to 74 in 2015. But as that security video seems to show, sometimes methadone becomes currency too, as addicts entitled to get it sell it on the street. And the flow of heroin just keeps coming.
There's no shortage of supply. Sometimes we say in law enforcement we can take off multiple kilos of heroin at entry points in the U.S., whether it be New York or L.A., and we're only seeing a few days of interruption before the supply is right back on the street again. It's almost like sticking your hand in a bucket of water. You put it in there and it's displaced for a little bit, and as soon as you pull your hand out, it immediately comes back in.
Out on the street, Tiffany says she knows few treatment success stories.
Most of them relapse. I can't think of anyone that I know personally who's stuck with it and stayed clean. Everyone that I'm close to or that I know well has relapsed, overdosed. It does make you feel hopeless, because if 30 other people that you know couldn't pull it together and get their life straight, am I going to be able to do it? I mean, it really is a nightmare to be an addict.
As we ended our conversation, Tiffany added, being an addict is also easier than trying to get back everything she's lost. For the 11 News I Team, I'm Jane Miller.
Now, prescribing another drug along with an opioid could decrease opioid-related adverse events. Naloxone is a fast-acting drug used to stop the effects of opioids. Researchers found that patients who are prescribed naloxone have fewer opioid-related emergency room visits compared to patients who are not prescribed that medication. Here in the U.S., accidental opioid overdose is a leading cause of injury-related deaths. Joining us now, a discussion with a distinguished panel. First, Mark O'Brien is joining us. He's Director of Opioid Prevention for Baltimore City. Also, Kevin Sherd has a heck of a story. He wrote this book, Lessons of Redemption, a former drug dealer, but since then has partnered with the White House and Baltimore City's mayor's office on strategies to combat substance abuse, and now speaks around the world with public health policy. And Harford County Sheriff Jeffrey Gaylor, just saw him in Jane's piece. His office is committed to treating victims while tracking down the dealers. Thank you all for making time for us. We appreciate you all coming by. Mark, let's start with you because we'll start simple. How does an addiction like this start and take over somebody's life?
Yeah, thanks for asking, Jason. The truth is that it really isn't simple. There are a lot of different ways that people wind up addicted. As we saw, the increase in opioid pain prescriptions has been a big factor in the increase in addictions and overdoses that we've seen. But there really is no single profile for how people get addicted or who gets addicted. Sure. This is impacting everyone in our city. We're losing one person a day in Baltimore to overdose. These are our parents, our children, our brothers and sisters, our friends and neighbors. And we really believe that there's tremendous value in every life and the health of every single resident of Baltimore. That's why we're implementing a three-pronged strategy to combat this heroin epidemic. And it starts with sending everybody to don'tdie.org, DONTDIE.org, to get trained to save a life today.
Talk to me a little about, because you're saying it touches everyone. Let's talk about young people. I remember in our day, a little younger, marijuana was the drug that people were talking about. Parents closed doors or new friends, that kind of thing. Is that what a parent should be looking out for?
They really ought to be looking in their prescription cabinet and making sure that their drug cabinet is locked up, that these prescriptions aren't available to children, and really keep an eye on their children. But it's also the other way. Children are witnessing their parents overdose on these drugs and get addicted. And that's why we're really emphasizing getting people into treatment, helping them to build a better tomorrow after we save their life today.
Sure, Kevin here's lived a heck of a life up to this point so far, and you've spread your message to young people throughout colleges. What are people talking about now? What's the chatter when it comes to opioids?
Well, I think prescription drugs is the gateway to a lot of this problem, right? So you got a lot of young people that are starting out with prescription drugs and not realizing the danger that they're putting themselves in. And then it ends up into much worse things like, you know, now they're out in the street buying heroin in a dangerous environment.
When I think heroin, I think big time drug, but as you watch the video and you see the number of people involved, I mean, this is common now.
It's common, it's a big problem, and so I'm a huge advocate of prevention. I think that we have to educate our young people before they even go down that road, because young people are smart enough to figure it out, but we gotta give them the tools to protect themselves, and that starts with educating them on the dangers of prescription drugs, because they might not be using heroin today, but they may end up using it tomorrow if they're not making good choices today.
So part of the education is for those involved in drugs, but also for people who are fighting it, and I'm guessing for police force, you had to do some educating with officers and their approach. Yeah?
Absolutely. Upon taking office, you know, we looked at the growing heroin epidemic, not only in Harford County, but across the state, across our nation. And we changed some of the response norms, I guess, for the sheriff's office, and some of that has grown and been emulated by other agencies, and I'm happy about that. We now send a drug investigator out on every single overdose. And that drug investigator is to look mostly so we can target the dealers, you know, from a law enforcement standpoint, mostly so we can target the dealer and figure out who is selling in our communities. But the other part of that is to try to steer that individual toward treatment. You know, we have help cards where we can immediately put that person, if they survive the overdose, on the phone with someone from the health department, but a peer, someone who's walked that path, who knows the path to recovery, and hopefully can start that conversation and steer the person to a healthier lifestyle. And Kevin could not have said it better. You know, we see some of the treatment recovery rates. They're not great. I mean, it's still a path that we got to fight hard for, but we need to concentrate on prevention. We need to make sure our young people and people of all age, because this drug affects them all, stay away from it to start with.
As with any drug, is putting someone towards the path to treatment, is it a tough sell? Is it tough when you're handing out the cards or when you're talking to someone that might be involved?
It's tough because a person has to be ready, right? They have to be ready to go down that road. And it'll be a tough emotional and physical challenge for them to do that. It might be even a financial burden, right? Because a lot of addicts are working addicts, right? So they have jobs. So to be able to go away from a job where you're earning income to take care of your family and go into treatment for 30 days or whatever, that might be a tough sell, but there's no other option. I mean, once you're addicted, you have to go into treatment.
This isn't something you can do it on your own. You need a professional.
That's rare when it comes to opiates, right? People have done it, but it's rare for a person to go just cold turkey and just without any help. That's very rare.
Are there limitations when it comes to treatment, when it comes to numbers? I was reading about in some cities, it's tough to help everybody because the funds may not be available for everyone to get treatment.
Yeah, I mean, of course it is tough, and we would always love to have more resources, but we have a crisis information and referral hotline that gets over 1,000 calls a week of people looking for treatment, and we're able to put them into treatment, whether they need mental health, substance use disorder treatment. We're able to make those connections, and so when people are ready, we want to be there so that there's no wait time. People need to get the help they want today, because as Kevin was mentioning, when people are ready, it's time to go.